The U.S. government and private healthcare agencies are currently taking several steps to improve prescription safety. 20% of doctors are using electronic prescriptions to eliminate errors caused by bad handwriting. Some hospitals now have computers that automatically calculate appropriate drug doses based on age and weight. They also flag possible allergies or drug interactions. The computer system used at the Vanderbilt Children's Hospital in Nashville, Tennessee, has reduced prescription errors by more than 95%. Hospitals are also using other technologies to manage patient medication.
Okay, and I'm going to scan your armband here.
We use a machine like this to match a barcode on the patient's wristband with a barcode on the medication itself, making sure it's always the right medication in the right dose for the right patient.
Robots are filling prescriptions 300% faster than people at high-tech pharmacies. But mistakes still happen, so always double-check that your name, barcode, and social security number match. The most sophisticated computer systems don't have the power to overcome communication breakdowns between doctors, nurses, and patients. To help with these issues, a process called medication reconciliation was started in January 2006. It makes it mandatory for patients to give their medication history when they go to a hospital. Then their records must be kept up to date every step of the way. But in order for this to work, you first need to know exactly what medications you're taking, why you're taking them, and if you still need to be on them.
So ask your doc, because the doc will educate you on that. Why am I getting this? How should I take it? What shouldn't I take it with? You know, if you shouldn't take it with grapefruit, you should know that. If you want to take it with tea, you should know that. But each thing you should know exactly. How long should you take it? How often? What should you take it with? What shouldn't you? What adverse effects can you expect from it?
With all these questions, it's a good idea to write down a checklist and bring it to your doctor. Another question to include is, can I get a generic drug instead of the name brand? But then you might be wondering, are generics as safe?
They do have to meet quality standards through the Food and Drug Administration to show that they are, in general, equivalent to the brand name medications. Now, there are some medications where changing between generic and brand names is a little bit risky. And so in those instances, what I would advise people is it's okay to take the generic as long as you stay with the same generic from the same generic manufacturer. You shouldn't be switching around because there might be minor variations.
And what about buying your prescriptions online? It's often cheaper than your local pharmacy, but is it safe? Especially when you're ordering drugs from overseas.
We've all of a sudden got a rash of fake, forged pills, as we call it. They look the same, they have the same name on it, they're pretty good at even putting all the individual markings on it, but they don't have active ingredient in them.
So ask for generics and only use mail-order drugs from America. But the safest and most important thing to do is talk to your pharmacist.
If you can develop a rapport with a pharmacist that will listen to you, that will take down your list of medications, over-the-counter medications, herbal remedies, and so forth, that will allow them to identify any potential problems in your medication regimen.
Once you get your prescriptions, there are steps you can take to safely manage your medications. A simple $4 solution is to use a weekly pill box. And if possible, bring along a patient advocate to help you with your pills and other medical questions.
Definitely have that third-party patient advocate in the hospital to help you when you're having medication administered. Double check to make sure it's the correct medication, and to help avoid errors and lack of communication or bad communication with a particular staffing person in the hospital.